This week, Jo has learned how to perform a range of physical assessments. She started by learning the importance of first impressions and the observations that you make when you first engage with a patient. Then she learnt the various components of a neurological assessment, including the Glasgow Coma Scale. She learnt the systematic procedures for conducting respiratory and cardiac assessments and the importance of anatomical landmarks. In the abdominal assessment, she learnt that you look and listen before you touch so you don't disturb the abdominal area. In the musculoskeletal assessment, she learnt the system of look, move and feel. And in the neurovascular assessment, she learnt the system look, tone, power, reflexes and sensation. Time to meet with Drew to wrap up her week.
Thanks. You tired?
Yes.
Been a big week?
Yes.
How'd you go?
A good week though.
A good week? Oh, I'm glad. How did you go?
Learned a lot.
Yeah?
Yeah, refreshed lots of things that I'd learnt before and now just have to practice and get better at it.
Yeah, it's really important. As I say to everybody, practice is so important. It's good to practice on your family, practice on friends, grab anybody. Just don't grab people in the supermarket. They don't tend to like it too much. Anyway. So what are some of the key points that you learnt this week about assessment?
Well, I wrote down a few things that I noticed were particularly important when I looked at physical assessment, and the main thing was communication.
Yep.
Both with your patient to make sure that they're comfortable with you doing the assessment on them, and then also to get their cooperation during the assessment so that they're aware of what's going on and they can assist you to do it properly and so you get accurate findings. And then the other thing was to realise that with each of the physical assessments there's a systematic approach which will ensure you have a thorough, comprehensive assessment and you don't miss anything.
Yep.
As you've seen, making decisions about patient care is dependent on your ability to conduct a thorough physical assessment. In all assessments, communicating and developing rapport with your patient is essential. Taking a relevant patient history always comes first. A thorough history will provide you with a picture of the factors that may have caused the patient's presenting problem and will guide the assessment. By using a systematic approach, you will be sure you won't miss anything and your findings will be reliable and consistent. The findings of your assessment are essential for planning, implementing and evaluating care and need to be communicated to other members of the healthcare team. For this reason, you must always document your findings on both the patient chart and notes and report any abnormalities to a senior member of staff. All nurses need to be competent in physical assessment. Like Jo, you will need to continually practice. Use the expertise of the clinical experts around you. Don't be afraid to ask questions, and you'll be on your way to developing confidence in the full range of physical assessments.
That's what I've learnt and now just have to keep practicing.
Great, great. Well, I'm glad to see you've used your pen that I gave you. That's really good. And you've
Very
still
useful.
got it. Nobody's flogged it. That's great.
No, holding on tight.
Yep.